Healthcare careers make up the largest occupational field in the U.S. Did you know that there are over 300 different health occupations? If you want a career in the health industry, the first thing you will need to know is what the education and certification requirements are in the different fields, and also a general idea about the different types of healthcare professions. The educational requirements for different healthcare jobs vary, from less than high school for some entry-level positions to doctoral level degrees for higher positions, and everything in between. Deciding how much time and money you are willing to spend in school may be a good starting point for you to start planning your health career. It's important that when considering an academic program in healthcare, that you make sure it's from an accredited institution, meaning that they have been approved by national organizations as a legitimate program. One must be particularly careful of this if choosing an online program. In addition to getting a degree, most healthcare professionals also have to take an exam to earn their credentials to prove that they are competent enough to actually practice. There are 3 different types of credentials: licensure, registration, and certification. Licensure is granted by the state, just like your driver's license is by state. Some states have reciprocity agreements, so you can move and still practice in a different state than where you took your exam. Other professions may require you to take a licensure exam in the state you move to. Some health careers that require licensure include physicians and mental health counselors. Registration is nearly the same thing as licensure, but is granted by passing a standardized national exam. Examples of healthcare professionals with this certification type are radiologic technologists, respiratory therapists, and physical therapists. Certification is usually granted by professional organizations, not at a state or national level, and certify that someone has received additional training. It is usually not required, but it can improve job opportunities. For example, a phlebotomist may or may not be certified, but certification may make the individual more attractive to employers or eligible for higher pay. Healthcare professionals may also earn certifications in different specialties, like an OB nurse may obtain certification as a lactation specialist, or a physician assistant may specialize in emergency medicine. We have already established that there are more than 300 different healthcare professions, and we can organize them into 5 different career areas, or clusters. The first and largest cluster are the therapeutic careers, or those that involve direct patient care. These include doctors, PAs, and nurse practitioners, who are all important medical professionals who can diagnose and treat patients. Nurses, who screen and monitor patients, advise doctors, implement their treatment plans, and provide personalized care to patients. And medical assistants, who conduct many routine tasks in medical practices, allowing care providers more time with their patients. There are also physical therapists, occupational therapists, athletic trainers, and prosthetists, all who help people with injuries or disabilities to regain optimal physical function. Respiratory therapists are like physical therapists for the lungs. They help patients with respiratory illness to improve their breathing. Paramedics and EMTs are first responders that help to stabilize and treat individuals in the community and safely transport them to the hospital for care. Pharmacists prepare medications and educate consumers about potential side effects or drug interactions. Chiropractors, massage therapists, and acupuncturists use various forms of touch and physical manipulation for a therapeutic effect. And dietitians or nutritionists help individuals plan meals to help them meet their dietary needs and goals. Mental health workers, such as psychologists and social workers, provide therapy in individual or group settings. And don't forget those healthcare workers who treat animal patients, veterinarians, and vet techs. Another career cluster are the diagnostic careers, or those that are involved in determining the presence, absence, or extent of disease, and providing data on the effectiveness of treatment. Many of these individuals are responsible for conducting different types of tests or analyzing samples. Some of these jobs involve working with patients directly, while others are behind the scenes. Some examples are cardiovascular technologists and EKG technicians, who are important for diagnosing heart disease, and EEG technicians who monitor electrical output of the brain to determine normal or abnormal brain activity. Radiologists can read and analyze images that are produced by skilled radiologic technologists in X-ray, CT, or MRIs. There are medical sonographers that use sound probes to image internal organs, and nuclear medicine technologists that inject radioactive materials for imaging, such as PET scans. Phlebotomists are skilled at drawing blood samples to send to the lab, where clinical lab technologists and lab assistants perform tests on various types of patient samples. Pathologists are doctors that usually only see patients after they die. That's because they analyze tissue samples from biopsies and perform autopsies to determine cause of death. Another important area of healthcare that's often behind the scenes is the area of health informatics. This is the area that manages and communicates all patient information and treatment information and is critical to the functioning of the healthcare system. These individuals ensure that patient information is secure, correct, and appropriately documented for billing. Some of these jobs include health administrators, medical billers and coders, health information technicians, and medical transcriptionists. Support services are also necessary for effectively delivering therapeutic and diagnostic services to patients. These include biomedical engineers who design medical equipment, biomedical technicians who maintain and fix medical equipment, and industrial hygienists who audit healthcare facilities to make sure they are functioning ethically and efficiently. Lastly, there are individuals who conduct research in the health sciences to improve our knowledge of the mechanisms of disease and discovery of new therapies. There are medical scientists, who are doctors that also conduct research, usually in a clinical setting, research scientists, who have PhDs and manage labs that are full of research assistants, who usually conduct all the experiments. And that is just a brief overview of some of the health careers you will learn all about this semester.